All right, so today's wellness tip, day 3 of our 12 Days of Diamond, is going to talk about chiropractic. I'm going to talk about chiropractic with kids. And the reason I'm going to do that is I just adjusted this lovely little girl. And a chiropractor, let's flip over on your tummy. In chiropractic school, you learn to do what's called palpation. I think another doc friend of mine is on too. So we go in and we feel these joints, and we can feel where there's restrictions, okay? So I can tell that right in this area she's restricted. Now she was wrestling around with like 3 boys, very active boys this weekend. Yeah, and one of them put his knee in her shoulder here. So there's a lot of
on my shoulder here.
Oh, on your shoulder. Well, you got restrictions here too. So what I'm feeling is the joint is feeling just a little bit stuck. Okay, so we let that just go. What'll happen when you have these stuck joints is that the muscles will get really tight in there. So does that feel a little bit tight in there, Sarah? Kinda, yeah. If she was an adult, she might be kind of falling off the table because there's little trigger points that are developing in there. I just adjusted her neck because she had a little bit of a little gland swollen. And in chiropractic too, when the joints are restricted, especially here in the neck, I think I've talked about this on a longer video, but in her ears, I could feel when I put my little pinky in her ears, I could feel this one side was closed down a little bit. And when that first vertebra, very close up here, the second vertebra actually is a little restricted. Her first vertebra was over a little bit, and the second vertebra was a little restricted. And so right in here is a little tightness and a little bit of a lymph node that is just getting a little bit swollen. And so this ear too was closed down. So the hole, like when I put my pinky in there, it was a little more closed down than the other side. And that's one of the ways that I tell if someone is restricted as well. Not all chiropractors do that, but I do. Okay, so she has a little bit of restriction in here. I don't know if I can show you here. Let's see. Chiropractors don't always have to adjust on a table, and they can use lots of different tools. But I'm just going to use my hands here, and I'm just going to put a little pressure. We may or may not hear a pop. No, we're just going to put a little bit of vibration in. There we go. Okay, a little bit of pressure. There was no cracking, but now there's definitely more movement. I can almost see it too. Okay. All right. So this is a technique that is, chiropractic adjusts a lot of different ways. So this is what we would call diversified kind of techniques or manual manipulation. Okay. So I'm not going to keep going, but all of these different areas of the spine have a lot to do with different areas of your health. Okay. So this upper spine here, when we have a lot of restrictions in this area, in adults, you'll see things like a little bit of acid reflux or vomit type burps when this gets really restricted. There's been some good research with that in terms of digestion and things like that. The upper area, lots of headaches, of course, here. Ear issues, ear infections. That's why it's really wonderful for kids. Neither one of my kids have ever had ear infection, right? They've never had tubes or anything like that. So that's really, really important. This neck area is just, especially this upper part of the neck, has a lot to do with sympathetic and parasympathetic, meaning fight or flight. And what else? So as we get into the lumbar spine here, into the sacral joints here, a lot to do with digestion. So a lot of people get restricted in here. We've got a dancer on the floor here. A lot of people get restricted in here. They'll have better bowel movements. I had a lot of patients who had better bowel movements. Now, something interesting too about this area, the sacrum, okay, and the lower booty area as we call it, the sacrum area has a lot to do with breathing. Oh, and of course the thoracics have a lot to do with breathing and asthma type conditions there. Now, look, can I show them your knees, Sarah, and your feet? Well, let's go this way. Okay, this way's fine. Okay, so another thing that chiropractors will check too is leg length. Okay, for kids, a lot of times they do grow a little bit uneven. You can almost see, this is the top of this ankle. It's not, you got lay back down, because sometimes for adults, especially who are totally grown, that might mean there's something up here that needs to be adjusted. Now, I know for her, a lot of times she has tight IT bands because she doesn't stretch enough. And look at that.
I'm stretching right now.
You're stretching right now. Okay, look at that. See how that even lengthened out that. So just a little bit of release on that IT band. Sorry, honey, I know that's tight. Can help this leg start to... Another thing could be the joints here in the hip. Sometimes these joints need to be adjusted, and that can be something as simple as up and down. Oh. Okay. Okay. So we're I think done showing. But the last thing I want to show. Okay, so you have ankles that can be adjusted, affect the knees. People with flat foot. Oh, can you stand up, Sarah? I want to show the feet. So you can adjust every joint in the spine. But the feet, especially, because I had clients talking about flat feet.
Hi, can I
Okay.
back to you?
Okay. Come on, kids. Thank you. People want to learn about this. Okay. So with flat feet, that means that, spread that a little bit apart. Thank you. That means the... Okay, guys. Thank you. Okay. So this arch for her looks like it needs to be adjusted a little bit. Can you see that falling a little bit? She's been having some ankle issues. She's been twisting her ankles a little bit. I think her shoes are a little bit too big for her. But it has to do a lot with the ankles affect the knees, affect the hips, okay? So someone might say, oh, I've got a lot of back problems, or my side is bothering me. It might actually have to do with the foot. Now, if there's a real problem and someone has had, they need to do that, we might have to put an insert. So a lot of good chiropractors will work with a company called Foot Levelers or something like that to get foot inserts. So this technique, talking about chiropractic and how you can adjust the whole entire body for good health, right? And how many times have we ever had to go to the doctors, right? Besides the doc, 0, right? Because we are a healthy family and we use chiropractic, we use natural things to help us stay healthy. It doesn't mean that we don't get sick. It means that we just get healthier quicker. And I believe that chiropractic, adjusting your full body in your spine, can help the body stay healthy. All right, say goodbye, everyone.
Where's the candy?
Bye. All right, talk to you later. Bye-bye.